Most recently, I've been working with, I teach at a school of nursing, and I have been working with freshmen, which is an entirely different experience. However, I really feel like my med-surg background and my base in med-surg is really what sets them up to do well in the rest of their curriculum, and I really believe it's the foundation for a lot of nursing practice. General med-surg, you can have anything from, say, a pneumonia patient all the way to someone with a very complex surgical situation, colon cancer surgeries. You could have a patient with renal failure. You could be doing dialysis, peritoneal dialysis. You could be doing that. You could be changing dressings. You really have to have a strong foundation and a really broad base of knowledge. I think that's probably what I like the most, is you get to touch a little bit of everything. It's not the same every day. It's different, and it makes it more exciting. I had an aunt who was a nurse, and she was a labor and delivery nurse, and I wanted to be like my Aunt Maria. And Aunt Maria said, you have to start on med-surg and spend a year there. And I wasn't sure she was right, but I did it because that's what Aunt Maria said do. And I have enjoyed it, and it did end up being my practice area. Many institutions will pair you with a preceptor or someone who can work with you. And that person may indeed end up being your mentor, but they might not, depending on the personalities and depending on your relationship. If that person's, always providing your evaluation, that might not fit as a mentor or someone who can guide you. For some, it might be a former nursing instructor. It might be another staff member on the unit that you've got some personal relationship with. We all start the day out gathering our information, gathering report, and recalling, hearing from where our patients have been and where we think they need to go. And so we make a plan. We check our labs, check our meds, and then begin the process of caring. Now, if you're on a day shift, it's going to be a busier time, and there's going to be a lot more departments that are going to be around. You've got the physicians, you've got pharmacy, you've got physical therapy, speech therapy, OT, social services. Everybody's there during the day. Most med-surg units, it's very typical to start your day out with your set list of patients, but to have one or two of those go home and one or two more come in. So that adds some challenge to your day in terms of, you might think you're going to have 4 patients today, but in actuality, you had 7. It's like a juggling act. You have a lot of different balls you're throwing in the air at the same time, and you become really good at juggling. Where do I need to go now? Oh, I think multitasking is really, I'm not sure that's a trait, but that would be one I would have to put high on my list. An ability to think on your feet, to process and use good clinical decision making. And I think nursing programs have been working over the last several years to really hone in on how do you make decisions and how do you think through a process. I think general organizational skills, whether it's somebody who's tied to a to-do list or whether it's someone who has another method, I think that it really ends up being very important for the med-surg nurse to be able to have those skills, to be able to pull them all together in a piece. And I guess the other thing that goes with coordinating is communication. You have to have really good communication skills. You have to be able to ask the right questions, provide really good answers. You have to be able to think about you have to really be a good listener for your patient, for their families, but then you have to be a good listener when you're listening to the providers and making sure that they're really answering the question you asked them, or they're really answering the question that the patient asked, or listening to, oh, that's what they're saying. That's going to take us in a different path. I need to let so-and-so know where we're going with that. So communication skills are really, really important. I think what I would have wanted to know was where med-surg nursing was headed. Because when I started med-surg nursing, it wasn't like it is today. It's more challenging than it was at that time. And while I see that as a good thing, I'm not sure, I think I had little rose-colored glasses on for a while. Well, it's not critical care, so it'll be okay. Well, wait a minute. First of all, that's selling the Med-Surg nurse way short. But second of all, it is just as important, and there is so much to do in Med-Surg nursing. I think there's a fallacy that it's very simple care. It's very challenging. I think maybe understanding how much more I needed to know about pathophysiology and anatomy and physiology and pharmacology. Maybe as I was going through school, that might have been those are subject areas I wish I'd spent a little more time on, because I think having that strong foundation really helps as you're working with the patient. You're going, oh, this is why we're doing this. And you can see how all the pieces begin to come together. It does form a solid nursing base. It really lets the student or the new graduate learn their practice, learn how to care for groups of clients, learn how to coordinate care among multiple disciplines, and work with numerous groups of clients. Now, while many people say that do say Med-Surg is a great foundation and a great place to start, I'm not sure that it fits all nursing, all nurses. And if Med-Surg isn't for you, then don't start there. You really have to look at what you think you want your practice to be. And while I would totally support anybody who wanted to be in Med-Surg, I'm not sure it's 100% where everyone should go. Our patients are so much sicker when they come. Way back when patients would come in and, they come in for their testing, and we would have time to sit and talk with them. We'd play cards, That's not the way it is today. The patients they're there, they're very sick. They don't come to the hospital till they're very ill. They require a lot of care. There's a lot of technical skills that need to be done. We have a lot of technology that helps us do what we do. And while that's fabulous, we have to, as Med-Surg nurses, make sure we don't let the technology stand in front of the patient, because the patient always is first. And they have not just one disease. They didn't come in for just a gallbladder surgery. They might have a lung problem, or they might have a cardiac problem, or they might have an ulcer, or they might have any number of other issues that are facing them, and you have to consider all of those issues when you're providing that care. That's made a big difference. One of the biggest things right now is the electronic medical record, getting used to using that system. Now, the new nurses that are coming out of school, they're really comfortable with that whole thought of point and click. Some of the nurses who have been around for a while, that's a real struggle, and we actually need our new graduates to help us in making some of those transitions and easing it and making everybody as comfortable with it as they are. I really see that Med-Surg has an opportunity to really be one of the leaders in providing quality patient care. I think that our ability to organize and coordinate is going to become even more and more important. I think that we're going to have much more the opportunity to impact the environment of the patient. I'm very hopeful the numbers of patients and the numbers of staff are going to balance such that we can get back to those things that we want to do as nurses. We want to be connected with our patients. We want to show them loving and caring compassion. And we want to make sure that we are committed to providing the highest quality of care to them. I think the Med-Surg nurses are right at the core of that. And I think we have a real opportunity to be the leaders and to demonstrate this is how it's done. This is a grand time to be entering nursing. I invite you to consider Med-Surg nursing as your specialty. I think it is a most rewarding of fields. But I will also say, if Med-Surg isn't for you, please find that part of nursing that meets your needs. You need to be involved in that part of nursing that really speaks to your soul. If Med-Surg is it, I would love to welcome you into that part of our profession. If not, go find your path.